Hello, I am Dr. Nimisha from Vaidya Healthcare. Today I am discussing about a topic, muscular dystrophy. What is muscular dystrophy? Muscular dystrophy is a progressive disorder. It's a progressive weakness or deterioration of skeletal or voluntary muscles that which controls the movements. It also affects the involuntary muscles like heart muscles also. And sometime in some patients it will affect the some organs also. So it's a progressive weakness or progressive disorder that it's affecting progressively, and ultimately it will cause the complete deterioration of muscles. And here some causes are explaining, certain genes are the responsible factors for making some protein in muscle fibers. Death of cells and tissues of muscle will happen here, and it's an ongoing progression happening here, and it's get worse over time. Main cause of muscular dystrophies are certain genes are the particular responsible factor for the making of or production of some proteins in muscle fibers. So here in muscular dystrophy, dystrophin is a particular protein. So the particular gene that is damaged or any problem, abnormality in that gene, that will affect the protein fiber formation. So here dystrophin or lack of dystrophin will cause the disease muscular dystrophy. So some symptoms like main symptoms are walking difficulty, frequent falls, and abnormal gait, and swallowing difficulty, breathing difficulty, and they can't like drinking, and the muscles will be weak on that area, throat area. And also some bulky muscles we can notice on their calf area, and while walking they can't walk without support, and they can't get up without support. After long sitting, it's very difficult. Muscular dystrophy mainly affected on children, like male boys, okay, and certain girls also. It's a genetic disorder, so boys are affecting mainly. And it's complication like walking difficulty, walking trouble, and moving of arms, that is also difficult, and breathing difficulty, and heart muscle getting problems, so some cardiac issues they will get, and also swallowing difficulty. These are all some complications. And in Ayurvedic view, it is Mamsa Shosha. Muscle wasting is Mamsa Shosha. Here in Ayurveda, according to Ayurveda, 3 doshas and Sapta Dhadus are balancing our health. So any vitiation of these 3 doshas or Sapta Dhadus, that will get our health some problems. So in muscular dystrophy or Mamsa Shosha, Vada dosha and Sapta Dhadus are affecting here. Imbalance of Vada dosha and imbalance of Sapta Dhatu will cause the Mamsa Shosha. So some particular reasons will come, and these imbalance will happen, and they will get wasting of muscles and weakness of the person, like upper and lower limbs or any other areas. This is the Ayurvedic view. So in Sapta Dhadus, they have their own Agnis. So we are telling like Dhatu Agni, it's a digestive power. So if any imbalance in one among these Agni, that will affect the whole Dhadus. So each Agni will cause the preparation of next Dhatu or formation of next Dhatu. So if any imbalance in this Agni, that will be like getting weakness of a particular person. So Ayurveda, here some special treatments we are mentioning in for muscular dystrophy. That is like Panchakarma treatments. We can provide some Panchakarma Ayurvedic Panchakarma treatments, and some special diet, and yoga therapy and pranayama therapy. These are all very effective for the controlling this wasting or this progression of, or arresting the progression of these symptoms mainly. So it's not like a complete cure, but we can arrest the progression, and the lifestyle or healthy life we can maintain by Ayurvedic treatment. So initially in Ayurvedic view, initially we can manage through some ruksha therapies. First internally, both internally and external therapies we can apply for these treatments. So acne we can maintain by Deepana Pajana types of Aushadas. So by that balancing acne we can maintain. Then after this digestion capacity and other vitals will be normal, then we can do some external therapies like ruksha therapies, like Udvartana we are telling, and Udvartana means a combination of some medicated powder the collecting, and by that we are using we are doing some special massages with that particular powder, and also dhara, herbal dhara, that is like a combination of some medicated liquid decoction we are using for dhara, whole body. And by that inflammation inside the body or inside the joints and inside the organs will clear, and then after some particular time, according to patient condition, we will plan some Panchakarma therapies. Panchakarma therapies like Vamana, Virejana, Vasti, like Niruha Vasti and Astabana Vasti, both Vastis we can given here. And Nasya therapies are beneficial for this dystrophic patient. So here some particular kiris we can provide, like ilakiri. It's partly we are making by some particular herbal leaves, and Jambira Pindasweda, that is other herbal preparation of partly. And other like Kadikiri, that is also one type of Swedana therapy. And Nyavarakiri. Nyavarakiri is a very effective therapy for this muscular dystrophy. That is some Nyavara rice milk and some medicated decoction we are preparing, and a combination of that we are making some potli and doing the therapy whole body. That is very good for the muscle tone and strengthening of muscles and nerves. So by doing this type of therapies, that particular patient will get strengthening of that particular area, and they can walk without support, or they can maintain their health by these type of therapies. And also this Panchakarma therapy, Nasya, it's a very effective treatment for the purification, like upper heart purification. Some nostril drops here applying, and it's a Shodhana Karma. It's a Shodhana Karma, and Sthidhikarana of Angas will do by this Panchakarma therapy. And detoxification also will be do by these Panchakarma therapies. Will be happen by these Panchakarma therapies, and some Swedana Karma and Virejana. Virejana means clearing all the doshas out of the body through Virejanas, Virejana Karma. In muscular dystrophy patient, yoga is having some important role. So we are providing some yoga classes and pranayama classes here. By this yoga therapy, they are getting good blood circulation, and they are getting strengthening of their muscles and nerves. And also it's very important to get reduce the tension, and they can maintain cool mind and calm mind. And also toxins will be removed by these yoga therapies. And some special asanas we can provide, like Surya Namaskara is the best among this yoga therapy, and Gomukhasana, Paschimottasana, Padmasana, Padahastasana. These are the important yogas we are providing here. And some pranayamas, that is very effective for muscles and muscles of lungs and heart mainly. And this pranayama like Anuloma Viloma is a very important one, and daily we can practice these yoga therapies for these muscular dystrophy cases. So for children we are giving these type of training classes here. So in muscular dystrophy patient, by considering the progression of this disease, the Ayurvedic Panchakarma treatments are very effective. We can we can arrest the progression by these Panchakarma therapies clubbed with physiotherapy and yoga therapy, etc., and by a special nutritional diet also. So the lifestyle and healthy life we can maintain by these therapies. So always by Ayurvedic therapies, muscle nutrition will be get increase, and muscle strength will be increased, and circulation will be clear, and they can balance their health by these Ayurvedic therapies.